So Andrew, can you tell us a little bit about what Angle does?
Yeah, Angle has got a specialist medical diagnostic product for capturing cancer cells from patient blood. This is very important for precision medicine, making sure that cancer patients get treatment that meets their particular disease requirements.
Are there any particular cancers that you are targeting?
Well, the great thing about this platform is it's very widely applicable to many different cancers. Our first clinical application, however, is in ovarian cancer, which is a particularly difficult one to detect.
Cancer is a very big market, of course, so what particular issues are you trying to address?
So the cancer market for us is about £8 billion a year, and what we're trying to address is the need to obtain cancer cells for analysis in order that the right therapy for a patient can be chosen. It's a scandal really that the new cancer drugs, although they're heralded as revolutionary, only actually work for about 1 in 3 of all the patients that use them. 2 in 3 patients are actually getting the wrong drug. So what we want to do is to basically harvest cancer cells from the patient blood from a simple blood test, so that those cells can be analysed and the right drug decisions made for the right patient.
So who's actually using your device at the moment?
We've worked for the last 2.5 years with Cancer Research UK Manchester Group, which of course is the research arm of the Christie Hospital, biggest patient hospital in Europe for cancer. But we're also working in the United States now with MD Anderson, which is the leading cancer centre. We've done groundbreaking work with the Medical University of Vienna on ovarian cancer. We've got some great work that's been done by Bart's Cancer Institute in prostate. And actually only this week, on Wednesday, we had an announcement from the University of Southern California, the Norris Comprehensive Cancer Center in breast cancer. So as you can see, there are multiple different big cancer centers working with our system.
I've heard that you've had a particular success in Vienna. Can you tell me more about this?
Yeah, the Vienna work was absolutely stunning. The problem with ovarian cancer is it's almost impossible to identify by traditional techniques. So that women who have an abnormal pelvic mass, which is a growth, and are having an operation for that, the doctors don't actually know whether they've got ovarian cancer or whether in most cases they're benign, but if they're malignant, they're highly, highly dangerous. And what's happened with Vienna is they've shown with a very high level of sensitivity and specificity that they can harvest the ovarian cancer cells from the patient blood, simple blood test using our system, and then analyse those cells to detect which patients have cancer and which don't. And so that's a very, very big step forward in the treatment of those patients.
This all sounds very positive, but what have you got coming out next? What can we expect from you guys in the future?
Right, well we've got a lot of things happening at the moment. A number of these big cancer centres have got new results coming through in some additional cancer areas. Big things that we've got on right now are moving the product into research use sales. So we've got a number of very interested customers lining up to actually to buy the system and the consumables to use in the research market. And the second big thing, which we referred to twice already, is the ovarian cancer side. We've got a big clinical study in train at the moment, and that's due to complete at the end of next year, and that will give us the opportunity to get into that £300 million market.
Andrew, thank you very much.
Thank you.